Hello everyone, welcome back to the channel. Today I'd like to show you a little template I created during my internal medicine rotation so that I could gather all the information from my patients and organize them so that I could present them to the attending, fellow, or resident. So, if you haven't started internal medicine rotation, just so you know, when you're doing inpatient, usually what you do is you come in, you log into the system, and you start studying absolutely everything about your patient or patients, and essentially just write everything down, so that you can present it to the attending. So what we're going to do is, first of all, I'm going to be using a little template I did for ICU. You can definitely alter this for inpatient or outpatient. It's just ICU is a little more tricky, so I'll use this one. So we have, first of all, the identifier. So we have ICU bed. We have, let's say like number 3. We have the patient number, which is what you're going to use to find them in the system. We have the date of admission. Here you can, usually they like it when you say like hospital day 5. And then you do chief complaint, the reason why they came to the hospital according to them. And later on, we start identifying the patient by their name, and we can over here just kind of put their age, like 70 years old. We can do male, female. You can circle the 1. And now let's go through their, history. So they have like allergies. This is very important. Make sure you ask. You can check past medical history, check past surgical history. And later we're gonna talk about, when you're in the ICU, we want to check your ABG, so your pH, your O2, your CO2. So let's do over here like ABG, and let's do ventilator settings, vent settings. So if they're not on a ventilator, of course, you just, does not apply. So yeah, again here, just in case, pH, PO2, PCO2, and bicarb. So here we're gonna move on to all of the lab values. So as you know, there's these little helpful diagrams. If you don't know, these is sodium. It's really good to learn. This is sodium, potassium, chloride. This is bicarb, but in the system it shows up as CO2 for us. This is BUN, creatinine, and glucose. We also have this other diagram, very important. We have here white blood cells, we have hemoglobin, hematocrit, and we have platelets. And lastly, we have this other little diagram for calcium, total protein. We have albumin, total bili, AST, ALT, and ALP. So over here, we're gonna move on to something important in the ICU. We have input and intake and output. So this is intake, this is output, and this is the difference. So they received, 1,500 of fluids. They urinated 1,000, and we have a difference of 500. So, of course you want to put like overnight. So for example, let's say overnight they lost 300, and I always like to use this little term like TU or TD, like trending up or trending down, just to kind of get an idea of how they're doing compared to previous days. And so we want to move on and put vitals, and we want to do, physical here, but just kind of like what's remarkable. Especially what's remarkable for the chief complaint or something that we're watching particularly. For the values, sorry to go back to it, also talking about chief complaint, let's say they come in with like acute kidney disease, so you're watching renal function, you want to add your own little things that don't fit in these diagrams. You want to do like osmolarity, GFR, BUN, creatinine, so on. You can put troponins depending on what you're looking for. You can do PT, PTT, etc. So moving on from that, we want to go over, cultures here, and imaging. So imaging being anything like ultrasound, x-rays, CT scans. So make sure to always put the most recent results first. So let's say like 6/1 here, and then 5/31, and just kind of only put what's relevant. Say like they showed MRSA, and imaging, of course, just same thing, 5/31. So moving on, this is a very important part. I want to go ahead, do a little something like this, and this is going to be for medications. This is going to be consults, plan, and update. Now, this is all incredibly important. You're going to put all of the medications, including their dosages, including, if it's oral, if it's IV, all of that. For consults, this is just in the ICU, you have all of these specialties visiting the patient. So you have, could be infectious disease, could be psych, could be cardio, and make sure to also put like the doctor's name. For the update, this is the gold. This is what your attending wants. So usually what I do, turn this around and start with yesterday. So what I do is I put yesterday, and I go through every single consult that happened yesterday. So I'll put ID, nephro, whatever, cardio, and I'll put whatever they recommended to do. So let's say like IM, for example, wanted to decrease the dose of heparin, or taper it or something. ID, maybe they found MRSA and they're like, well, all right, let's put them on Vanco, things like that. So you want to add all of this, as well as reminding the attending what was the plan they suggested yesterday, and then letting them know what out of that plan did they actually go through. Because sometimes, let's say they want to add a medication or a specific dose of the medication, sometimes the pharmacy actually adjusts that, or someone from another one of the specialties disagrees and just kind of has their own opinion about it, and you don't exactly end up doing this plan. And then we're gonna do the today. Now, this is very important. Everybody that comes to see the patient, you're going to stop what you're doing and you're going to go into the room with them, observe everything they do, their physical, because they might be looking for something that you missed. You want to see and ask them, what their plan is, what they recommend, and you want to start writing that down. It's better to do it in person than just go through the notes, but you can definitely look at the notes as well. They might put something in there they didn't tell you. And just basically write all of those recommendations down, and then you're gonna go write all of that here in the update. First of all, start with overnight events. No overnight events, or you can say something like patient had delirium and like pulled his central line, anything like that. And then you basically do all of this we did in the back, make it pretty, put it here. And when the attending comes in, you're going to present all this information, very organized, and they're going to come here and tell you, okay, we want you to call, get a consult with neuro. We want you to get case management. We want you to taper this medication, etc., etc. Oh, and last, I don't want to forget this. So I like to do a little corner here about the prophylaxis this patient is in. So for example, for DVT, maybe they're giving them heparin. For GI prophylaxis, maybe they're giving them, Protonix or Pepsid. Maybe they're giving them no IVF, or maybe they're just giving, like normal saline 0.9, antibiotics. You can put anything you want here that's relevant, just to kind of give a summary of what they're on. and of course you'll have those in the meds list as well. And so this is it. This is all the information you're going to need. So if you have to do the note with the whole HPI interval, all of that, sometimes they'll ask you to do it, then you have all of this organized and it'll make your life easier. If not, hopefully you don't have to, your residents will take care of that, then you can just give this to the resident and it'll be really nice to help them kind of have everything organized for the note. So yes, let me just put it like this so you can take a picture. Let me know if this works out for you. Share with me if you have a different template. And yeah, I hope you guys have a good rotation and good luck studying.